Well, good afternoon. Welcome to this fireside session in which we will talk about a big challenge, how to forward and how to implement global guidelines, global policies to the grassroots level when it comes to provision of assistive technology. My name is Luc de Witte. I'm president of the Global Alliance of Assistive Technology Organizations, which is an umbrella of professional organizations in this field, and we try to address the global challenges. And I would like to discuss the issue with three people from very different countries and very different settings, but what connects them is that they all work in everyday practice supporting people with disabilities to get access to assistive devices. So we have THUY Nguyen from Vietnam, we have Lorenzo DESIDERI from Italy, and we have William NGABO from Rwanda. So let's get started. We have seen a lot of development on the global level, a lot of attention for this field, and this conference is always a demonstration of that. And we know pretty well what the problems are in this field. But how does that translate to your work? So I would like to hear from you, what are the everyday challenges that you face, and how do they relate to these global documents and policies? May I start with you in Vietnam?
Yes, thank you for the question, and hi everyone. My name is Nguyễn THUY. I'm director for Research Center for Inclusion, and I'm from Vietnam. So we have been working a lot with people with disability and leprosy affected people as well, and in which we provide them with assistive device like wheelchair, orthopedic and prosthesis. And some challenge we face during our work is include like the unmatched between demand and also supplies. For example, we have very huge demands from people with disability or leprosy affected people. However, due to the limited resource, we are unable to provide as many as device as people need. And the other challenge we face is human resource. For example, when we provide the assistive device to people who receive it, and we supposed to follow up, like to re-evaluate, to see whether the device really work for people with disability, and also to see if any repairs needed, because people they cannot do it themselves. However, it's difficult for us to do this because we lack technician staff and also time. Meanwhile, we also have to reach new people. We have new people who in need of the support. So this is another challenge. The other challenge is the product. Usually the products in our country, we produce it with material imported from other country, which will increase the cost of the product to user. So because the product is price is high, so it's difficult for people from low income family can accommodate with it. And
so it's mainly the availability, the cost, and the expertise, the staff.
Yes.
These are the main things.
Yes. How they can utilize the local material to make the cost is.
May I go to Rwanda? Can you answer the same question? What are your challenges on the ground level?
Thank you, and hi everyone. As we are saying, my name is Rene from Rwanda, and I'm the executive director of a non-governmental organization called Rwanda Assistive Technology Access. What we do, our vision is to contribute to a society where persons with disabilities are able to study through the use of assistive technology so that they can live independently. Back to your question, the main challenges we face, one is that in our country, many people are not aware enough of assistive technology. including persons with disabilities and other people.
Yeah.
Even they are caretakers. And when you don't have the right information, it's not easy for you to get the right support. Another challenge is the lack of trained assistive technologists who can provide services related to assistive technology. And we have so many people to serve. And unfortunately, we have very few who are able to serve.
Yeah. So that's very similar to what we just heard from Vietnam. So
Yes.
yeah.
Another challenge is the high cost of assistive technologies and the inaccessibility of these technologies. Because in our country, it's not easy to find where you can buy an assistive technology product. Yeah. So another challenge is that the assistive technologies that come from abroad most of the time don't fit into our local context in terms of infrastructures and even the local language that is being used. In Rwanda, we have one local language, which is Rwanda, and many persons with disabilities speak that local language.
Yeah.
And when for example, you get those assistive technologies, let me say softwares designed for persons with disabilities,
Then they will
most of the time they are in foreign languages, and our people, they don't understand those.
So lots of work to be done. Lorenzo, may I ask you about the Italian situation? What?
Yes, thank you for the question. My name is Lorenzo DESIDERI. I here represent the Regional Center for Assistive Technology, which is founded by the regional government of Emilia-Romagna and the local healthcare authority. And we provide guidance and information on assistive technology to people with disabilities and their families. And I think that our challenges we experience at grassroots level mostly mirror those that you have already mentioned, but we may have connecting these to the, for instance, the principles of the global report. I would say that in Italy we lack a truly person-centered approach to service delivery, mainly maybe because our healthcare system is the main driver for assistive technology provision, and it adopts mainly a medical-centered approach to the provision of assistive technology, and this might create some conflicts and confusion when assistive technology is implemented in other sectors such as education or employment, which are based mainly on right-based approaches to support. Another challenge is also the fact that our services might be very fragmented and so developed through silos. And I think that this is something that also the global report emphasizes, to achieve a more integration within services in order to avoid delays or different interpretations on the usefulness of assistive technology for specific purposes. And last but not least, we also lack opportunities for those who want to become professionals in assistive technology to be trained, especially at the academic level, to become to fulfill their ambition to become professionals. So we have some opportunities, but it's not systematic. So that I would say.
So that's clearly one thing that you all share, the lack of expertise and training facilities, the lack of staff, trained people who can work in this field, but also availability. So I would expect Italy to have no challenges left, but that's not the case.
Never the case.
May I go to the next question? As I said in the beginning, we are GATU is a collaboration of professional organizations. What do you think can organizations like GATU and its members, what kind of things should we do to support you in meeting these challenges? Because it's clear that a lot has to be done, but it's difficult. It seems to be a big disconnect between your level and all these global. May I start with you again?
Thank you for your question. I think for our current project, we develop some kinds of training material Unfortunately, we do not have the opportunity yet to transform it into kinds of app or thing like that. Because when we transform the training material into app, and then it will reach a lot of user, and it's make use the knowledge. And in terms of cost, in terms of the lack of a human resource, we expect like both on-job training and also, like you mentioned, systematic capacity building education for people who want to become professional. Because in our country, apart from lack of technician in IT, we also lack of experience as well, experienced staff as well. Because for those who have a lot of experience is reaching retired age. So this is one of the issue that we want to support, want to receive the support.
So training is clearly one of the issues, and help with translating things into in app forms. That's really clear. May I ask you same question? What can we do to support your work?
Thank you. We need much more capacity development. Yes, regarding assistive technology, and I think there is another need to identify passionate people in our countries or in other countries, because there are people who, with or without support, they are ready to give their 100%, so that the assistive technologies can be accessible to everyone. So there's a need to identify them and putting strategies that really identify them. And I think when working with them, it can lead to really expected results. Another thing is to have strong centers where you can find everything about assistive technology, even the assessments, from the assessments, the products, and the centers that are linked to the sellers worldwide.
One last remark, because we're running out of time. For Lorenzo.
10 seconds. I would say I would ask GATT or international organizations to disseminating good practice examples of organizing assistive technology and also evaluating assistive technology service delivery, and help also individual professionals or small groups of experts within a country to connect together to create national organizations in order to share practices and approaches to service delivery and assistive technology delivery.
Well, it's you give us a big agenda of things to do. We'll definitely include that in our policies and our plans, but we will need you to realize it. So be careful. We will get back to you. Thanks a lot for this discussion, and well, thanks for your attention.